Hello, my name is Dr. John Cowie and I'm a dentist working in the UK. This is a video for anyone over the age of about 9 years old and will teach you how to look after your teeth properly. So why do we want to look after our teeth? Well, because any filling we can do in dentistry is nowhere near as good as what nature gave you. Your natural teeth can last you your entire lifetime, whereas a filling is said to have done well if it's lasted for 10 years. Also, when tooth decay reaches the nerve of a tooth, the pain you get from that is said to be the third worst pain in the world, just behind childbirth. In this video, I'm going to talk about the 5 fundamental things you need to do to avoid tooth decay, to avoid gum disease, to have a bright white smile and to have fresh breath. So the first fundamental is to use a good systematic brushing technique. Now there's 2 parts to this. There's using a good brushing technique and using a systematic technique. So first of all, we need to think and appreciate that there are 3 surfaces to a tooth that need to be cleaned, and every surface does need to be cleaned if we want to avoid getting tooth decay. So there's the outside surface here that sits next to the cheeks, then just here there's the chewing surface, and then the third surface is the inside surface that sits next to the tongue. So that you don't miss any of these surfaces of the teeth, you need to have a systematic brushing technique. Now, it doesn't matter what your system is as long as you have a system. So for example, one system that you might choose to use would be to clean all of the outside surfaces next to the cheeks first, going around one side, then going around the other side. Then you can move on to the chewing surfaces and clean all of the chewing surfaces. And then go on to the inside surfaces next to the tongue. And then that would be the lower teeth complete. You could then do exactly the same thing on the upper teeth. Now that's an example of a system, but if you have any other way of doing it in any other order, then that's absolutely fine, as long as you have some kind of order and some kind of system so that nothing gets missed out. Now what a lot of patients do when they brush their teeth is they do a really long, hard scrubbing action like this. It's a hard scrub and they tend to get quite a lot of strength from their arm into it. Now this is not a very good way of brushing your teeth for 2 reasons. Number 1, it's very easy to brush too hard, so you can put all the strength into there, and brushing the teeth and the gums too hard can cause the gums to have recession. So on this model here, you can see that some of the teeth have got recession and where the gum has shrunk back. Also, when you brush your teeth in this way, it's not very effective at cleaning the teeth. Now, the teeth get clean from when the bristles of the toothbrush change direction. So if you instead do a little circles brushing action like this, the bristles are changing direction much more often, and so this will clean the teeth better. Little circles is the way that we'd recommend, but it's often very difficult to get used to little circles, especially if you've been doing a big hard scrub all of your life. So what I recommend for a lot of patients is, instead of doing little circles, to do a little micro scrub. So this is just, it's like a vibration movement, just slowly going around the teeth, but vibrating the toothbrush and just doing a very small scrubbing action forwards and backwards. This is effectively the same as doing the little circles. It allows the toothbrush to change direction much more often, and it also doesn't let you brush too firmly. So using the little circles or the vibration movement is really good for doing the outside surfaces next to the cheeks, so you can do all of those surfaces using this method. It's also good for doing the inside surfaces of the teeth next to the tongue. But when it comes to doing the chewing surfaces just here, you actually want to scrub those, because they have deep nooks and crannies that the bristles just won't get down by doing the other methods. So you want to, scrub reasonably firmly across the surfaces of those teeth, and then the surface of these teeth here, and then that'll get into little nooks and crannies there and clean those teeth out effectively. A common part of the mouth that people miss when they're brushing is the backs of the front teeth. So both the bottom ones and the top ones get missed around here. So to brush those properly, as Anthony's going to show us now, to brush the backs of the lower teeth, he's raising his elbow. That's good. And then to brush the backs of his upper teeth, the elbow drops. Perfect. Another area that patients commonly miss when they're brushing is this little gap just here, right where the gum meets the tooth, all around here. I often find that patients are very good at brushing the big smooth surface of the tooth up here, but they miss the gap where the gum meets the tooth. This leads to a build-up in plaque around that area, and then that leads to the gums getting red, they get inflamed and swollen, they bleed easily, and this is the start of gum disease. So to clean out this little crevice where the gum meets the tooth effectively, what we need to do when we're brushing our teeth is to take the toothbrush, and instead of holding it sideways at 90 degrees to the tooth, we want to angle the toothbrush 45 degrees downwards towards the gums so that the ends of the bristles poke right down that little crevice and they clean that crevice out effectively so we can keep healthy gums. So we want to angle it downwards at 45 degrees for the lower teeth, and if these were the upper teeth, then we want to angle it upwards at 45 degrees to clean the upper teeth. Tip number 2 is to use the right toothbrush and the right toothpaste. So when choosing a toothbrush, you want to choose a toothbrush with a comfortable handle, because it needs to be comfortable when you're brushing. You want to choose one that's got a small head so it can comfortably get all the way to the back of your mouth. You want to have one with soft or medium bristles so that they're not too abrasive to your gums. And ideally, you also have bristles of different lengths to clean little gaps between your teeth. So if you've tried an electric toothbrush before and you don't like the electric toothbrush, then I'd say carry on using your normal manual toothbrush and that'll be fine if you really don't get on with one of these. But if you've not tried one of these before, I would recommend getting one because they are more effective at brushing your teeth than a normal toothbrush. So when you're buying an electric toothbrush, there's 3 main brands. There's Oral-B, this is an Oral-B brush. There's also Philips Sonicare, and there's also Colgate. Now I prefer all of them to a manual brush, but the research that's been done shows that this Oral-B one is best for most people. So if I make a recommendation on a toothbrush, then I am going to have to recommend this Oral-B toothbrush. Now, an electric brush will do all of the hard work for you. So when you're brushing your teeth, you just turn the power button on, and you want to angle the bristles down towards the gums, just as we did with the manual toothbrush, like this. And you hold the bristles on one tooth for about 3 seconds, then move over to the next tooth, a few seconds, move on to the next tooth, and you go around the whole mouth like this, and it will clean your teeth for you. So when do you want to replace a toothbrush? You can see that this one has been freshly taken out of a packet. That's perfect. This one has gone way past the point at which you want to change it, and you actually want to change a toothbrush when the bristles first start to splay. If I show you my electric toothbrushes, you can see that this is a perfect out of the packet one, and you can also see that there's a colour indicator just here. Now that's full colour, whereas this is exactly the same head, and this colour has pretty much completely gone. That's an indicator that it wants to be changed, and actually, from looking at the bristles, they are a little bit splayed. This probably wanted to be changed earlier, and you want to change your toothbrush just as the bristles start to splay outwards. When choosing a toothpaste, you need to choose one with the right concentration of fluoride in it. So what you want to do is go to the supermarket and have a look at the back of the toothpaste on the ingredients list. About halfway down the ingredients list, there'll be something called fluoride there, and in brackets, you'll see a number. There'll be a number, and then straight after the number, it will say ppm. That stands for parts per million, and that tells you how concentrated the fluoride is in the toothpaste. The number that you're looking for is 1,450 ppm, and that's a good strong concentration of fluoride, and that's what you'll get in all the big name brands. All the Colgates and Oral-B's and Aquafreshes and things like that tend to have that, but also the supermarket brands will usually have that as well. So you don't have to go for a big name brand toothpaste. The most important thing is that it contains 1,450 ppm of fluoride. The third tip is spit, don't rinse. This is a really good tip. Because the fluoride in toothpaste is so good for your teeth, why would you want to wash it all away? What I want you to do is to brush your teeth and then build up all that frothy layer of toothpaste as you're brushing your teeth. Then when you're finished, you want to spit out the excess toothpaste, but don't rinse with water. This will allow all the good ingredients in the toothpaste to sit on your teeth and carry on working for hours afterwards. If you do feel that you want to rinse out with water, do that before you brush your teeth and then don't do it afterwards. When to brush? The answer to that is always before bed and one other time of the day as well. Now, I want you to brush your teeth for 2 minutes, and 2 minutes can seem like quite a long time when you're doing it, so I want you to time yourself when you brush just to see how long you are actually brushing for. Now, brushing before bed is the most important time because when you're asleep, you have less saliva in your mouth. Now, saliva is actually really good for your teeth, and through the day, your body will make a whole pint of saliva which washes over your teeth and contains ingredients in it that help protect your teeth. Now, when you're asleep, your body makes much less saliva. So if you have food on your teeth and plaque on your teeth and you don't have a little layer of fluoride over your teeth while you're sleeping, that's when tooth decay is going to start and progress. You want to be brushing one other time of the day as well. Now, after a meal is a very good time to brush your teeth, and after breakfast is perfect for most people. But if you're having a particularly acidic meal, so an acidic meal would contain lots of citrus fruits, for example, so things like oranges, or if you're having lots of pickled foods, or if you're having acidic drinks like orange juice, Coca-Cola, and then lager and wine are very acidic as well. If you're having acidic food, then it's best to wait an hour before you brush your teeth. This is because when you have lots of acidic food and drink, on a microscopic level, this acid will dissolve a very, very thin outer layer of your tooth, and that will go soft. If you brush straight away, then you'll brush off that little thin layer of tooth and that'll be brushed off and gone forever. Whereas if you wait for an hour, then your saliva will actually re-harden the tooth and it will be the same just as it was. Now that hour can be shortened by chewing sugar-free gum, because sugar-free gum makes you produce more saliva, or you could do a mouth rinse. A dental mouth rinse would help as well, and even a rinse of water would help neutralize the acid too. Tip number 5 is limit how much sugar you have. Now, living in your mouth normally, you have thousands of bacteria. Now, those bacteria have lived there all your life and they'll live there the rest of your life. Some of them will cause tooth decay, and their food source is sugar. So if you put lots of sugar in your mouth, giving those bacteria sugar, then they will produce tooth decay in your mouth. So what we want to do is limit the amount of sugar we have, and an important message is that it's about how often you have sugar, which will cause tooth decay. So to give an example, if you have a packet of Smarties and you take your Smarties and you down the packet and eat the entire packet in one go, that's one big sugar attack on your teeth in that day. Now that is not as bad as if you take the same packet of Smarties and you have one Smartie every few minutes throughout the whole day. So if you do that, then you're bathing your teeth in sugar through the whole day, and that long exposure to sugar is going to be much worse for causing tooth decay. So we say limit the amount of sugar you have, and if possible, just try and keep it to after meal times. Then the amount of sugar attacks will be lower. Typical things that are full of sugar would be fizzy drinks, chocolate, biscuits, sweets, and that kind of thing. They're the obvious ones, but you've also got to watch out for hidden sugars. For example, did you know that tomato ketchup is full of sugar? Baked beans in tomato sauce, there's loads of sugar in the tomato sauce. And also you get lots of ready meals, and often ready meals from supermarkets have lots of sugar in too. I mentioned earlier that acidic foods can erode your teeth, but your teeth can also become stained. And the things that will stain your teeth are tea, coffee, red wine, spicy foods such as curry, and also smoking. However, stained teeth can have the stains removed and can be lightened in colour by a dentist, so it can be reversed. Now, I've just described my 5 fundamental tips for looking after your mouth, and for most people that's enough and you don't really need to do anything more. But if you do want extra protection, then what I would recommend is using a fluoride mouth rinse. So you can buy a fluoride mouth rinse such as this one, and when you use the fluoride mouth rinse, what most people tend to do is they'll brush their teeth and then use the mouth rinse afterwards. Now, this is not the best way to do it. If you do the spit don't rinse technique that I described earlier, then using the mouth rinse will give you no additional benefit, because you're just exposing the mouth to fluoride the same way as the toothpaste is, and it's not giving any more benefit. So what we say to do is to brush your teeth twice a day and do the spit don't rinse technique, but then use your mouth rinse at a different time of the day. So if you brush your teeth after breakfast and before bed, then use your mouth rinse at a different time of the day, like when you get home from work in the evening or at lunchtime. One last little tip I'm going to show you is how to find out how good you are at brushing your teeth. What you want to do is go to your chemist or your dentist and buy some of these things. These are called plaque disclosing tablets. And what they do is they'll stain your plaque on your teeth a certain colour. And then you can see the patterns of where you're brushing well and where you're missing with your brushing. First of all, take some Vaseline and put it on your lips so that you don't stain your lips. Then take the tablet, chew it up and swish it around your mouth for 60 seconds. Next, spit it out and have a good thorough rinse with water. We can now examine the teeth to see the bits that we have been missing with our brushing. We can see that there are several areas that I have missed, particularly around the gaps between the teeth and around the gum line. Now you can practice your new brushing technique and make sure that all the purple patches of plaque have been removed. Okay, so this is the end of this video. I hope you've learnt something new, and please look out for my other videos on how to look after a child's teeth and how to look after your teeth if you have gum disease or if you have sensitivity. Okay, happy brushing everyone. Bye.